Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A client suddenly develops facial drooping, slurred speech, and right arm weakness. What should the nurse suspect? A. Myocardial infarction. B. Stroke, CVA. C. Heart failure. D. Seizure. Correct answer, B. Stroke, CVA. Rationale: sudden facial drooping, arm weakness, and speech difficulty are classic signs of a stroke. Question 2. Which action should the nurse take first when a stroke is suspected? A. Assess the airway, breathing, and circulation. B. Give oral fluids. C. Administer insulin. D. Encourage the client to walk. Correct answer, A. Assess the airway, breathing, and circulation. Rationale: airway, breathing, and circulation, ABCs, are always the priority in emergency care. Question 3. A client arrives at the emergency department 1 hour after stroke symptoms began. Which diagnostic test should be performed immediately? A. CT scan of the head. B. Chest X-ray. C. Abdominal ultrasound. D. Colonoscopy. Correct answer, A. CT scan of the head. Rationale: a non-contrast CT scan distinguishes ischemic from hemorrhagic stroke before treatment. Question 4. Which statement about Alteplase, TPA, is correct? A. It can be given for all strokes. B. It dissolves clots in eligible ischemic stroke patients. C. It lowers cholesterol. D. It treats hemorrhagic stroke. Correct answer, B. It dissolves clots in eligible ischemic stroke patients. Rationale: Alteplase is used for eligible ischemic strokes after hemorrhage has been ruled out. Question 5. Which assessment finding is most common in a client with a left-sided stroke? A. Aphasia. B. Left-sided paralysis. C. Impulsive behavior. D. Poor judgment. Correct answer, A. Aphasia. Rationale: left-sided strokes commonly affect language centers, causing aphasia. Question 6, SATA. The nurse is assessing a client for stroke using the FAST method. Which findings are included? Select all that apply. A. Facial drooping. B. Arm weakness. C. Speech difficulty. D. Time to call emergency services. E. Temperature. Correct answers, A, B, C, D. Rationale: FAST stands for face, arm, speech, and time. Question 7. Which client has the greatest risk factor for stroke? A. A client with uncontrolled hypertension. B. A client with seasonal allergies. C. A client with eczema. D. A client with gastritis. Correct answer, A. A client with uncontrolled hypertension. Rationale: hypertension is the leading modifiable risk factor for stroke. Question 8. A client with dysphagia following a stroke should receive which nursing intervention? A. Perform a swallowing assessment before oral intake. B. Offer thin liquids immediately. C. Feed the client while lying flat. D. Encourage rapid eating. Correct answer, A. Perform a swallowing assessment before oral intake. Rationale: a swallowing assessment reduces the risk of aspiration. Question 9. Which position is most appropriate for a client immediately after an acute ischemic stroke? A. Head of bed elevated about 30 degrees. B. Trendelenburg position. C. Flat on the abdomen. D. Sitting fully upright at 90 degrees. Correct answer, A. Head of bed elevated about 30 degrees. Rationale: elevating the head promotes venous drainage while maintaining cerebral perfusion. Question 10, SATA. The nurse is teaching a client how to reduce the risk of another stroke. Which instructions should be included? Select all that apply. A. Control blood pressure. B. Stop smoking. C. Exercise regularly. D. Take prescribed medications. E. Stop medications when you feel better. Correct answers, A, B, C, D. Rationale. Managing risk factors and adhering to prescribed therapy help prevent recurrent stroke. Medications should not be discontinued without provider approval. Question 11. A client has a right-sided ischemic stroke. Which assessment finding is most likely? A. Left-sided weakness. B. Aphasia. C. Right-sided paralysis. D. Difficulty reading only. Correct answer, A. Left-sided weakness. Rationale: a right-sided stroke affects the left side of the body because motor pathways cross in the brain. Question 12. Which intervention helps prevent aspiration in a client with dysphagia after a stroke? A. Keep the client flat during meals. B. Elevate the head of the bed during feeding. C. Give thin liquids only. D. Encourage rapid eating. Correct answer, B. Elevate the head of the bed during feeding. Rationale: sitting upright during meals reduces the risk of aspiration. Question 13. A nurse is caring for a client who suddenly becomes unable to speak. What should the nurse do first? A. Activate the stroke protocol. B. Give oral fluids. C. Allow the client to rest. D. Administer pain medication. Correct answer, A. Activate the stroke protocol. Rationale: sudden neurological changes require immediate evaluation and treatment. Question 14. Which medication is commonly prescribed after an ischemic stroke to reduce the risk of another stroke? A. Aspirin. B. Morphine. C. Insulin. D. Furosemide. Correct answer, A. Aspirin. Rationale: antiplatelet therapy helps prevent future ischemic strokes. Question 15, SATA. The nurse is assessing a client for increased intracranial pressure following a stroke. Which findings are concerning? Select all that apply. A. Decreased level of consciousness. B. Severe headache. C. Vomiting. D. Unequal pupils. E. Increased appetite. Correct answers, A, B, C, D. Rationale: these findings suggest increased intracranial pressure and require immediate intervention. Question 16. A client with a stroke has expressive aphasia. Which nursing intervention is most appropriate? A. Ask simple yes or no questions. B. Speak very loudly. C. Finish every sentence for the client. D. Avoid communicating with the client. Correct answer, A. Ask simple yes or no questions. Rationale: simple questions help clients with expressive aphasia communicate more effectively. Question 17. Which finding is most important to monitor after administering Alteplase, TPA? A. Signs of bleeding. B. Blood glucose. C. Heartburn. D. Appetite. Correct answer, A. Signs of bleeding. Rationale: Alteplase increases the risk of serious bleeding, including intracranial hemorrhage. Question 18. Which nursing intervention helps prevent contractures in a client with paralysis following a stroke? A. Perform passive range of motion exercises. B. Limit movement of affected limbs. C. Keep the client on bed rest continuously. D. Place pillows under the knees permanently. Correct answer, A. Perform passive range of motion exercises. Rationale: range of motion exercises help maintain joint mobility and prevent contractures. Question 19. A client recovering from a stroke suddenly develops a severe headache and vomiting. What should the nurse do first? A. Notify the healthcare provider immediately. B. Encourage oral fluids. C. Administer food. D. Reassure the client. Correct answer, A. Notify the healthcare provider immediately. Rationale: these symptoms may indicate hemorrhage or increased intracranial pressure and require urgent evaluation. Question 20, SATA. A nurse is teaching a client about stroke prevention. Which instructions should be included? Select all that apply. A. Control blood pressure. B. Take prescribed medications. C. Stop smoking. D. Exercise regularly. E. Stop medications once blood pressure improves. Correct answers, A, B, C, D. Rationale. Blood pressure control, medication adherence, smoking cessation, and regular exercise all reduce the risk of recurrent stroke. Medication should not be stopped without provider approval. Question 21. A client who had a stroke suddenly develops unequal pupils and becomes difficult to arouse. What should the nurse do first? A. Notify the healthcare provider immediately. B. Encourage the client to sleep. C. Offer oral fluids. D. Reassure the family. Correct answer, A. Notify the healthcare provider immediately. Rationale. Unequal pupils and decreased consciousness may indicate increased intracranial pressure or hemorrhage. Question 22. Which complication is a major concern for a client who remains immobile after a stroke? A. Deep vein thrombosis, DVT. B. Migraine. C. Cataracts. D. Peptic ulcer disease. Correct answer, A. Deep vein thrombosis, DVT. Rationale. Immobility increases the risk of venous thromboembolism. Question 23. A client with a stroke has right-sided weakness. Which assistive device should the nurse place on the client's left side? A. Call light. B. Bedside table. C. Personal belongings. D. All of the above. Correct answer, D. All of the above. Rationale. Items should be placed on the unaffected side to promote independence and safety. Question 24. A nurse is assessing a client with a suspected hemorrhagic stroke. Which symptom is most characteristic? A. Sudden severe headache. B. Gradual weight gain. C. Frequent urination. D. Dry cough. Correct answer, A. Sudden severe headache. Rationale. A sudden, severe headache is a common symptom of hemorrhagic stroke. Question 25, SATA. The nurse is caring for a client after a stroke. Which nursing interventions help prevent complications? Select all that apply. A. Reposition every 2 hours. B. Perform passive range of motion exercises. C. Monitor swallowing ability. D. Encourage early mobility as appropriate. E. Keep the client flat in bed at all times. Correct answers, A, B, C, D. Rationale. These interventions reduce the risk of pressure injuries, contractures, aspiration, and complications of immobility. Question 26. Which finding indicates improvement in a client recovering from a stroke? A. Speech becomes clearer. B. Increasing confusion. C. New facial drooping. D. Decreased level of consciousness. Correct answer, A. Speech becomes clearer. Rationale. Improving speech suggests recovery of neurological function. Question 27. A client with a stroke has neglect of the left side. What is the best nursing intervention? A. Encourage the client to turn the head toward the affected side. B. Perform all care from the unaffected side. C. Ignore the affected side. D. Limit movement of the affected side. Correct answer, A. Encourage the client to turn the head toward the affected side. Rationale. Encouraging attention to the affected side helps reduce neglect and improves function. Question 28. A client recovering from an ischemic stroke is prescribed clopidogrel. What is the purpose of this medication? A. Prevent blood clots. B. Reduce blood glucose. C. Increase heart rate. D. Treat infection. Correct answer, A. Prevent blood clots. Rationale. Clopidogrel is an antiplatelet medication that helps reduce the risk of another ischemic stroke. Question 29. Which client statement indicates understanding of stroke prevention? A. I'll take my blood pressure medication every day. B. I'll stop my medication once my blood pressure is normal. C. Smoking doesn't affect stroke risk. D. Exercise isn't necessary. Correct answer, A. I'll take my blood pressure medication every day. Rationale. Consistent blood pressure control is one of the most effective ways to prevent recurrent stroke. Question 30, SATA. The nurse is teaching a client about warning signs of a stroke. Which symptoms require immediate emergency care? Select all that apply. A. Sudden facial drooping. B. Sudden arm weakness. C. Sudden difficulty speaking. D. Sudden vision changes. E. Sudden severe headache. Correct answers, A, B, C, D, E. Rationale: these are common warning signs of stroke and require immediate medical attention. Early treatment improves outcomes.
What is your score out of 10? Comment below. Don't forget to like, subscribe, and share this video with a friend who's preparing for the NCLEX. See you in the next practice session.